meeting is being recorded.
All right. Well, thank you for joining us today for our survivorship special topic. My name is Julie Lanford, and I am the Wellness Director at Cancer Services. We are a cancer support agency, nonprofit here in Winston-Salem, North Carolina. So each month, and this is new for 2023, but each month Cancer Services is going to post a special topic video with experts in a variety of areas related to cancer survivorship and caregiving. And these videos will be posted on our website. On the slide here, you'll see find each month's info at cancerservicesonline.org/special topics. So in the future, if you're looking for other topics, you can find those there. We'll also have it posted on our YouTube channel, and I'm going to take the audio and put it on our podcast, which is the Triad Cancer Connection. So there's many ways you can listen to our information with these awesome experts. All survivors and caregivers are also invited to join for a survivorship special topic discussion group each month. So it will be on the fourth Tuesday of each month, and you can choose whether you want to come in person to our office at Cancer Services on Maplewood Avenue. It'll be the fourth Tuesday at 1 p.m. if you're coming in person, or at 7 p.m. online via Zoom. And for January, that will be Tuesday, January 24th. And we do ask that you register. You don't have to tell us whether you're coming in person or on Zoom. You can kind of decide that the day of if you'd like, but we do need to know if your intention is to come to one or the other. You can go to cancerservicesonline.org/register to sign up for the survivorship discussion group. All right, so I'm going to move on to our special topic for today, which is priorities and well-being. Maintaining focus on what's really important. So our expert speakers today are Lisa Rainwater, an oncology counselor for Atrium Health Comprehensive Cancer Center, and Decarlos West, who is a social worker for Novant Cancer Institute. We decided to do this topic because, first of all, it's January. So, of course, we're all thinking of a new year and what we might want to reset in life. Obviously, some of the things we'd really like to reset, we have no control over. Wouldn't it be nice to just press the reset button on cancer? But we can't always do those things. However, there are some parts of our lives that we have some influence over. So maybe not diagnosis itself, but how we cope with cancer and the impact on our lives. So today's experts are here to help us with that. I am excited because we'll touch on a few different areas that many cancer survivors and caregivers face, give you practical tips on how to take steps forward, identifying your priorities, and enhancing your well-being. So let me introduce our first guest, invite her on, Lisa Rainwater. So, hey, Lisa.
Hello. Hi, everyone.
Lisa is the Integrated Clinical Programming Manager for Psychosocial Oncology and Cancer Patient Support Program at Atrium Health Comprehensive Cancer Center. And I got all of that out without messing up. Woo! Okay, so she is a clinical mental health counselor and provides counseling for individuals, couples, and leads support groups for survivors, caregivers, and healthcare providers. And I have attended some of her sessions, which have been really great. So thank you, Lisa, for joining us today.
Absolutely. Thank you for having me. It's an honor.
So I want to start by getting your thoughts on what you think are some of the most important things that people can be doing to support their mental well-being during and after treatment.
Sure, absolutely. I'm going to share my screen. And what I like to do is have folks think about their cancer journey as one aspect of life. So often it feels like, particularly if you're in the middle of treatment, that it is the only thing in life. But as we know, we have various facets of our wellness. And this wellness wheel is a really wonderful, simple way to understand how cancer can actually impact your life and how this wellness wheel can help you readjust and reset, as you said in the introduction, Julie, to adjusting to life with cancer, and then also after treatment, adjusting to life when there might be uncertainty and fear of recurrence. So we look at these 8 different aspects of wellness And you'll see the first one at the top is relational. So that is your social relationships, your social groups, your community groups, your friends, your family. Who's in support of your journey? Who are you supporting in their journey? It's a reciprocation of love and support. Emotional, always important to check in on your emotional well-being when you're going through cancer treatment. And one of the ways is you can seek counseling. You can come to groups like this where Julie leads discussions, but we also have support groups where people actually come together and talk and support each other on their journeys. You also have both vocational and financial, which are on the opposite ends of the wheel. When you're going through treatment, you may have to stop work for a period of time. You all will know that cancer is a very expensive endeavor. So, and I think our guest, Decarlos, is going to talk about financial well-being. So looking at how does cancer impact your financial security and stability, and what does work life look like for you during treatment and post-treatment is something important to keep in mind as you're paying attention to wellness. I like the intellectual wellness because that's the one that helps you with chemo brain, which we'll talk about in a bit, but it's the curiosity in life, the intellectual stimulation. So you're creative, you read, you write, you watch movies, you paint perhaps, something that you do that gets your brain working and stimulated again after you've gone through treatment is really important. Environmental. I always ask my clients, where are all your medications? If they're on top of the kitchen counter, how often do you walk past the kitchen every single day looking at what's screaming out, I have to take those pills? Is there a place in your home that you could put them where you don't forget them, but it's not a constant reminder of having to take pills, having to deal with a difficult disease and a treatment protocol? So looking around your environment, but also getting into nature. Nature is so refreshing and so reinvigorating, which connects with the physical. Short walks in nature is a wonderful way to connect and improve your wellness. And then finally, spiritual. What is purpose and meaning in your life? Pre-cancer, during cancer treatment, and post-cancer, because this journey is going to transform you in many ways. And as you go through the journey, reflect on your values and your beliefs and what is really important to you, whether that's a religious conviction or a spiritual conviction to a higher power. Paying attention to that during your wellness journey is also really important.
Wow. Okay. I love the visual. And I also have, I work with people around wellness. I think a lot of people tend to sort of get stuck, or they think about wellness, they think only about physical wellness, sometimes emotional, but they don't always see how all of these relate. When you're working with clients, how do you help them figure out like what areas maybe they need to look a little bit more at, or maybe what areas they need to focus less on? I don't know.
Sure, it's a really great question. So as a strengths-based counselor, what I want to do first and foremost is identify the areas that are the strongest in an individual's life, because those are the things you're always going to gravitate toward in times of distress and times of joy even. So if you've got a really strong support group and you are spiritually connected and you like to go on short walks, I would just encourage that person to continue those. But then it's, well, where do you think you could add a little bit of extra time each week or every month, or somebody who could help you, like Decarlos West, who could help you with financial issues, right? So relying on the strengths to look at where you could use those strengths to help with the things that are in deficit is usually a pretty easily targeted way to start the process of rounding out. I like to look at a wellness wheel as sort of like your bicycle. If you remember when you were a little kid and you had all those spokes, and if one or two of those spokes were bent or missing, it was really hard to get the bicycle wheel rolling. And I give it the same. If you've got one or two aspects of your wellness that aren't being taken care of or addressed or nurtured, all the other ones kind of fall to the wayside as well, because it's really a full picture. It's a wholeness and a wellness concept of life and living that gets us through even the most difficult times, such as cancer.
Okay, that makes sense. So Now we all know what it's like to hear, you know, oh, hey, think about this, think about that, find your strengths, find your weaknesses. And then, you know, okay, maybe I need to do a little bit more of this. I think the hard part is, like you mentioned, you know, finding the time to fit these things in if you already feel like you don't have enough time. Is time a common barrier, or are there other common barriers that you find people face when they're trying to implement some of these things?
Time is absolutely a barrier, particularly if you're really in the throes of treatment, because you all will recognize you have little control over your life. You have appointments, you have treatments, you have more appointments, you have labs, and suddenly you have no control over your calendar. So trying to address all 8 of these life components can be very difficult. What I encourage folks to do is see how they can connect. So if you're really needing some social time, combine it with physical activities such as walking, and then combine it with nature. So you've got 3 down at one time. If it's intellectual and it's emotional and spiritual, you might want to go to a community event where you're learning about another culture's religion or spiritual activities, and you bring a couple friends. So you've got 3 down again. You don't have to do them individually, because it's a wheel, it all moves together. But time isn't the only barrier. What I see a lot in my patients, particularly after they've finished treatment, because the treatment is, it grows with efficacy and the side effects the longer they're in treatment, is things such as fatigue and cognitive fog, which we call chemo fog or radiation fog. Those things can really be a detriment to focusing on any of these things, because if you don't feel well, you don't have energy, you can't think clearly. What do I want to do but just lie on the sofa and watch some Hallmark movies or, you know, a sporting event and just be done with it? So those are the types of things that can really be detrimental to applying a wellness wheel to your lifestyle post-treatment.
That's really helpful. I like the idea of combining the things, but also if it's really hard for you to combine the things or make the decisions, then I feel like that's a sign you're in sort of that space of like overwhelm. And I think, you know, for people to know that that's a time when you might need to seek out some help from a mental health provider to kind of get you over that hump, to choose something. So if, you know, we can help at Cancer Services connect anyone to the mental health provider at their treatment center or someone in the community that can help them if they need that. Okay. Thank you, Lisa, so much for these awesome, great ideas. And we'll check back in with you at the end.
All right. Thank you.
So our next guest is Decarlos West, an oncology social worker at Novant Cancer Institute. And prior to working at Novant, Decarlos worked in child protective services, adult guardianship, and as a social worker at a skilled nursing facility. So that is quite the combination there. So Decarlos, thanks for being here with us.
No problem.
So, okay, I know you help a lot of clients who are dealing with financial challenges, and we work very closely, our advocates here at Cancer Services, with you over at Novant, because there's a really high cost to cancer. Some people have great insurance and they get everything covered, and that's great. It can still be expensive if they're having to take off work, even if their care is covered, but also sometimes people don't have the best coverage or they don't have insurance, and so the bills can be completely overwhelming. So do you have suggestions on how people can prioritize when it comes to managing financial issues and the bills kind of side of things?
And you're right, we do. We have a lot to come through. Financially, I think everything is fine to some people, but then when you get sidetracked with cancer bills and hospital bills, medications and all that, it can be overwhelming. So one of my main things with prioritizing is, for one, once you leave the cancer center or treatment or anything, you still have to go home. Okay, you still have to go home. Those bills are still going to be there. So I suggest prior to, you want to get all of those bills sort of in hand. If you have to network with some of your local agencies, a DSS, you have urban ministries. You have a lot of different agencies you can reach out to that can assist. You even have churches that you can go to that can also assist in those household bills. Now, when it comes to your medical bills, you would probably want to reach out to a social worker or a financial counselor or someone in that capacity that can assist. If they don't have the answer, they will find it for you. And also, cancer services. I know we network with them a lot. Our supportive services coordinator, Stacy, also helps with that. But you have to identify what needs to be paid as well. Get all of that in hand and sort of let them sort it out for you and guide you in that capacity. Now, you also have nurse navigators that if you can't locate someone, they'll be able to locate them for you, especially in the hospital. That's someone you work with very close, if you have one, that they can just reach out to the social worker, financial counselor, business officers, anyone on your behalf, and they can speak with them and go from there. Now, with that, you would want someone to sort of seek out some type of, I would say, what it would be, let's see, the counselor, the financial counselor, that we have new ones here that would assist with anything in regards to some type of financial assistance from any type of agency. They will look it up, find it, and they will link you to it. Now, sometimes it's not available. Sometimes it is available. If it's not available, you have other avenues you can try. But it's best to just sort of squeeze every little bit, squeeze it out.
Got it.
You got to squeeze it out of them.
It sounds like from an organization standpoint, people could make a list or separate their household bills from their medical bills.
Yes.
At least keep a list of that so that they know, because their medical bills, if they're going to need to talk to somebody about help with medical bills, they're going to do that at the facility. But if they need help with their household bills, they may be going to multiple different kind of places for help with that.
Correct. And a social worker would do it. They can see, right. they can find both. Okay. They can find medical and out there in the community.
Now, if let's say somebody has a defined amount of money, they can't pay both their household bills and their medical bills, do you have advice on how to prioritize that? Or is that something that, the social worker, or their financial counselor can help with?
It'll be the social worker. The financial counselor would, sort of try to guide you to billing and see if there can be some type of arrangement made. Maybe seek out, the new ones that we do have, seek out grants that can possibly assist. Our supportive services coordinator what she would do is say, well, I tell you what, let us take care of a household bill, take that off your hands, and then maybe you can have some money left over to pay your medical bills. So they go hand in hand and try to work it out the best way they can.
Got it. Okay. And I know that our advocates at Cancer Services also will help people know,
yes, regardless
of what cancer center you go to, will help know who to ask for what. And the community resources, because what I've heard, and maybe you know better than I do, but what I've heard is that sometimes funds that you find, if you just go look on the internet, I need help with cancer bills, and you find some group on the internet and you can apply for their money, but sometimes funds are open, sometimes funds are closed. And so you could spend a lot of time applying for a fund that, quite honestly, the social worker or your cancer services advocate would already know. Don't bother your time with that because that one's not open. So having your sort of coordinator be at your treatment center here at Cancer Services, to help guide you as to which ones. And like you said, sometimes they'll fill it out for you. So that's really handy.
It can be overwhelming to a lot. I know we deal with them, every day, and it can be very overwhelming. And then, you'll have some type of, mental health breakdown because they're trying to figure out, hey, how am I going to pay this? How am I going to pay that? You also have them to the point to where, well, you know what? I have to feed my family before I get this treatment. So they come at you at every different angle, but you will have to use your resources to sort of get through it. That's what they're there for. They're there to help.
Yeah.
My whole big thing is don't be too prideful. Don't be afraid to ask because the help is there. You just got to ask for it.
Yeah. And I think it ties so well together, yours and Lisa's information,
Yes.
because it is, it's really hard. And it does kind of feel like you're alone, but that's what, at least, at Cancer Services, we work well with Novant and Baptist, and they both have financial people. They both have mental health and oncology counselors. So we just want everyone to know the resources are there. You might not know them yet, because a lot of times you don't find out about them until you need them. But like Decarlos was saying, don't be afraid to ask for that help so that you can get connected to the person who can then kind of direct you or help assist with that. So thank you so much for sharing all that really helpful information, Decarlos. All right. So my next question is for both of you. So Lisa, you can come back on. When it comes to well-being, our relationships are really important. And of course, financial issues can cause stress in our relationships. Just the addition of a new diagnosis or having to do more caregiving than someone might be used to can put stress on relationships. So some people seem to just naturally be very supportive and helpful, and others try, but aren't as supportive, bless their hearts. And then there's the others who actually just are not supportive at all. So do either or, both of you have advice on how people can prioritize relationships that are life-giving and supportive, and share thoughts on how to manage those relationships with people that you probably, you can't cut them out. Like, we're not talking about cutting people out, but like, how can you manage some of those relationships that maybe aren't quite as supportive? So Lisa, why don't you go first?
Sure. I like to describe friends and family with capital F's and friends and family with lowercase f's. And the first thing is, and Decarlos, you even mentioned this in your discussion, don't be afraid to ask. But the people that you ask are the people who have capital F's and capital F's for friends and family. They're the ones who either have gone through a cancer or another life-threatening illness themselves, or have had another person in their life has. So they are open and okay talking about things such as life, quality of life, end of life, fear of life, ending. There's other people who have either never had exposure, or they've had a really painful exposure and they haven't worked through it. So those are the kinds of people that are the smaller F's. They're still there. You don't want to cut them out, but you're probably not going to get a lot from them. And so to keep from spinning your wheels is my theme today, focus on those that you know are going to be there for you. The ones that are really, truly asking what they can do to help, wanting to help, and never to forget that when you let someone help you, you're giving them a gift.
That's true. Sometimes I forget that too. But what I've learned working in this space is like, there's a point in time where all of us need to, lean on others. And I think that's a really great idea too. Thinking about some take-home ideas is, what if people just spent a little bit of time defining who in their life fits the big F, friends and family, and who in their life fits the little F, and figuring out, how those people can play different roles. Decarlos, what are your thoughts on that
one? I think it sort of takes me back when I was actually working in the nursing facility, so to speak, because when you look at it and someone is in need or need help and an assistant don't have anyone, it sort of takes you back. But if you do have someone to assist, in what capacity can they assist you? So I'd like to, and some of the patients that I've dealt with here, again, when they go home, they still have to live. No matter what the family dynamics or what they have going on in that home, they still have to live. So I do ask a lot of, what value do they add to your life? I like to look at it that way, because it can be for the better or not so for the better, as a lot of things do go on. But, the ones that do add value to the life, they're going to be there supporting you no matter what, whether it's transportation, providing meals, letting you borrow money, or even taking care of a bill for you. And we like to look at some of the patients, say, hey, even before we assist sometime, well, do you have family? Do you have friends that can help you or assist with you? Sort of being more self-sufficient, and reaching out to others who can help you. Now, those who don't, and it's almost like the one that just take, whether it's taking your time, making you tired, and you don't want to function anymore, and things of that nature. You want them to still be there because you do have that connection, but it's going to take a sit down or a talking to. Sometimes even if family members, the counseling aspect of it will come into play, some type of family counseling. I know I'm dealing with one now. We're trying to work with family services. Just you can reach out in the community and find some things. You even a church home or things like that they can use. But it's very, very important that the people you have around you are there to support.
Yeah, good points. Like thinking about who's there, how do they function for you? Can you ask them for help? Do you need to ask for outside help in dealing with that relationship?
Yeah.
Awesome. Okay. So this is all really helpful. And as I close us out for today, I want to ask each of you to share one piece of advice that you'd like to offer the viewers. I mean, this is tough because there's so many different things, but if you have kind of one thing to leave people with, what would that be? So, Decarlos, I'm putting you on the spot to go first here.
Well, I would say ask for help. Ask for help. If you need it, you need to ask, and be very specific as to what you want so you can get the assistance that you need. But you can't be afraid to ask. A lot of people don't, and they wait till the last minute, and sometimes that help is not there, and they send everyone scrambling.
That is such a great point. Okay, Lisa, I didn't have you guys check notes beforehand, so hopefully you got something different.
I did my due diligence and I came up with two, because my first one was learn to ask and accept help, but I have a second one, which is also just for me as important. And is what I do actually when I work with individuals and families, is to help them learn to live in the here now, in the present. So many of the clients and patients I work with are suffering from symptoms of anxiety, symptoms of depression. Try to live right now, right here, not think about the future that creates anxiety, and not think about the past that can lead to regret and feelings of sadness and sorrow, but what's happening right now and what can I be grateful for? And sometimes you can't be grateful for anything, and that's okay too. But just to be right here, right now, and try to keep everything else outside of that plane of existence until you get through your cancer treatment. And then you can begin to think again about what's next.
Awesome. Well, you guys, that was very helpful, both of you. It's going to give us a good jumping off point for our part 2, which I'll mention to all our viewers that we do have a part 2 where I'm going to interview a survivor and life coach, Chris Ryan. And she'll help us dig into more about this information that our experts have shared, and then how you can turn that into your personal kind of next steps or things to consider. So let me just remind you about that all our videos are going to be posted on our website as well as our YouTube channel. And I'll make sure that we put contact information for both of our expert speakers today there, so that if you need to reach out to either us at Cancer Services or Decarlos or Lisa, you know how to reach them. And we'll have our discussion group. So if any of this has brought up some things you'd like to kind of touch base with others about, or kind of get thoughts from me and connect you to who you need to, please plan to join us on the 4th Tuesday. You can either come in person or online. You just have to RSVP at cancerservicesonline.org/register. And let's see what else. I think that's it. So thank you all for joining us today for our special topic Be sure to stay updated on our survivor programs by checking our website at cancerservicesonline.org, our email newsletter, and our social media channels. So have a great day, and we look forward to seeing you again soon.
Thank you.